thank you. Thanks, Adnan, for inviting me to speak about my case. So it's called the asymptomatic abyss. So it's a 67-year-old Nigerian male. He was referred for a second opinion, previously been seen elsewhere. He has no problems with his eyes. He's asymptomatic. He's got type 2 diabetes, hypertensive. He'd had a recent blood count which showed that he had a raised ACE at 90, but he had a chest x-ray which was normal. His vision's good in both eyes, 6/6. His eyes white. Anterior chamber, there were no cells, and the vitreous was clear. These are the wide field color photos. This is the autofluorescence. You know, I suppose the striking feature is the changes at the macula and then the peripheral changes. This is his OCT. Sorry, it's a video. Let me just... So the most striking feature are the massive deposits that are apparent in the OCT. That's the right eye. Sorry.
So, do you want to pause there, or do you want to motor through? Shall we?
We can pause there. I've got a fluorescein and ICG, but we can pause there for now.
So, any thoughts on the features? So, you got irregular elevated RPE, medium, slightly laminated reflective material between it. Brooks membrane's kind of interesting at the junction between the RPE and Brooks membrane. Any thoughts from anyone? Any ideas? And was the ACE done before this or triggered on this finding?
No, it was done before that.
Okay.
So you'd had a full inflammatory workup, and the ACE was the only thing that was raised.
Okay.
Tell us again the patient age.
67.
Okay.
Nigerian male.
Okay, so sub-RPE kind of material, fibrotic. The edge of Brooks membrane on the nasal side's a little odd there. It seems difficult to trace where it goes. And can you go back to another cut somewhere else?
Sorry, you want to go back to...
Go to another cut of the OCT. Nope. Fine?
Johnny.
I was going to love to see the angiogram.
Yes. Yep.
Sorry.
Straight. Yep. Angiogram.
Okay. Oh. So he actually had a B scan as well, because they were unsure what the deposits were, which didn't really show very much, apart from there were small elevations that could not be characterized, and that's how it was described. So just small elevations on the B scan.
So I presume they didn't, looking for some sort of internal flow or some other signal, didn't see anything?
Yep. So this is the fluorescein angiogram, the right eye at 40 seconds and then at 10 minutes. I suppose the most striking features are the choroidal neovascularization here and here. This is the left eye, early and late, and again, choroidal neovascularization. It's the ICG of the right eye, early and late. Slightly confusing. And this is the left eye. So the striking features are the macular changes, but there's also some peripheral changes as well.
So you're interpreting that as late staining, that large area of hyperfluorescence, the late ICG, and then the punctate changes in the periphery?
Yep.
Any thoughts from anyone?
Did he have android streaks? I found it interesting, the fact that it's perfectly symmetrical and seems to be irradiating from the optic nerve.
So android streaks, can we go back to one of the other imaging modalities, or the fluorescein on the earlier phase. It's quite difficult, the projection on here.
Yeah,
It doesn't project very well, sorry. You can go back to the autofluorescence.
yeah, I don't really see that per se. It's a possibility, but, I mean, you still have a wide array of inflammatory, infectious potential processes here.
I mean, so other clues they were thinking Android. So he was Nigerian, 67.
7-year-old male, asymptomatic.
And so if we're, I mean, Android streaks would be a possibility. So would this, I mean, he's not got sickle, I assume.
No,
And
sickle negative.
no other symptoms of any PXE type phenomenon.
no
I didn't
skin
see it. I
problems.
mean, they had the staining, but there were no peripheral comet lesions or anything else that was
No.
PXE-like. So we'd have to maybe look a bit closer with a OCT on the nasal side if you want to try and see if there are more obvious streaks there through the OCT or Braids and Brooks membrane. But it's difficult on what I've seen to be sure, but I think it's a reasonable thought. Any other thoughts from anyone else in the audience? Yep.
Did you test for TB? Because it kind
Yes.
of looks like serpiginous.
He was TB negative.
Great thoughts. So would you get that amount of sub-RPE material in serpiginous?
Not usually.
No. So it'd be it's possible. It's good thoughts.
Differential.
Again, it's a differential of radiating around the optic disc, which is an excellent differential. Good. Carry on.
Okay, thank you. So, as we said, our differential diagnosis: inflammatory, non-inflammatory, or masquerade. So it was thought that he had lymphoma initially, and that's what he was referred for, but he then ended up in a uveitis clinic, and he was treated for serpiginous. So we had prednisolone, 60 milligrams. He was seen a week later. There was no change. He was then started on mycophenolate mofetil.
So I presume his Q goal was positive, as they probably is highly likely to be. But
No, it was
yeah,
negative.
It was negative.
Yeah. But there was the ACE of 90, which made people think maybe it was sarcoid, maybe it was something else, maybe it was inflammatory.
So that's why I was asking. It wasn't. So the sarcoid workup was for a chest problem, or why did he have that in the past? Out of interest, can you remember?
I think because he'd been followed up for his eyes for a very long time. He'd
in
seen
another-
lots of different
okay,
doctors. He was
understood.
followed up somewhere else, and then that's fine.
Understood.
So he started on all this anti-inflammatory stuff. 4 weeks later, there was no improvement. His vision's still 6.6. He's still asymptomatic, but he's on a lot of medication now. So maybe we need to think again. Shall I carry on?
Yep. Thank you.
So then we went back to have a look at his OCTs and everything else. And like you say, we can see that there are
Yeah.
cracks there and here. So we can see that it is angiostrix.
Although it's not absolutely, in a peripheral position with multifocal choroiditis, you get little breaks in Brooks membrane. So that in itself is supportive, but I wouldn't necessarily say it's absolutely diagnostic. So we probably want to see other things.
Yep. I mean, we just felt that with 60 milligrams of prednisolone, there was no change. If this was inflammatory, it would have improved. It would have melted away, but there was nothing.
But there's not a lot of, I mean, there is sub-RPE fibrosis, but there's not a lot of other fluid or other overt inflammatory
That's right.
signs look as a sign of response to, and he was 6.6 anyway.
He was asymptomatic.
So what was the response to the steroids you were looking for?
Just some change. There was nothing.
So that's the problem.
I know.
So I think I still, so android streaks, were you convinced that you saw some?
So when we looked at this, looking at the infrared, possibly, and then looking again back at the autofluorescence, you could convince yourself that this is probably one here, and then these ones here coming out
So
from the
what
disc.
would be useful, as I said, is to get some OCTs perpendicular to the streak.
Yep.
Because there's so much going on. I'm not absolutely sure, but it is definitely, I think, as Gabriella suggested, a possibility.
So that's what we decided, and that's the diagnosis we went with after that.
Does anyone else agree or disagree with that thought?
I just want to ask you,
Was there vitritis or anything at all?
No, there was nothing.
Okay,
It
now,
was quiet.
When you say there is no improvement, what is it actually you're looking for? He's asymptomatic. There's no active choroiditis. So when you say he didn't respond to oral steroids, what is it you're looking for? No vitritis?
We were hoping that some of that fibrosis might have melted away, but it didn't.
I mean, I agree that one lesion looks suspicious for a streak. I'd love to see it going toward the optic disc. But I've seen a number of patients who are now like 50 years of age and had definitely angioloid streaks visible, and they were 20 years of age, and there's no hint of them anymore. So it's indifferential. I mean, it's probably as reasonable once you've done a negative inflammatory infectious workup. I could accept that as being a diagnosis.
Fine.
Yeah. So have you chased, if you assume it is angioloid streaks, are you going to chase an underlying association?
Yes, we're going to look for PXE. So we got his old records from 2014. Sorry, it's not beautiful. There are no pictures, but this is what was described. Angioid streaks, PEDs, hemorrhagic PEDs with the diabetic grading. And these are his pictures from 2021, and you might be able to see the angioid streaks maybe better on these colour images, maybe here.
So
So moving on to the DREAM OCT, unfortunately these are pictures of the screen because I haven't learned how to use the software yet. However, I've learned that now from yesterday. So
I'm glad you spent some time on the booth.
So this man has got massive membranes, so massive non-exudative choroidal neovascular membranes.
Yeah. That's definitely not a projection artifact. Yeah.
I mean, most people could see the membranes on this, even though most people don't see them with OCTs. So you can see the membranes. They are massive membranes, sparing the fovea though. So angioid streaks with large CMVM, stop the steroids, stop the mycophenolate. He's been referred for PXE testing, but he's got no skin abnormalities and he's asymptomatic. But we decided to treat these membranes with Eylea. I don't know what you think about that, Adnan.
But there's no exudative change.
I know, but
So why?
is it not going to go bad at some
Well, a
point?
stable type 1 CNV.
I know, but then there are other exudative membranes.
But
So
what's your, yeah, but I thought you said it was not exudative.
these ones, this one,
But is there fluid associated with it?
there's fluid associated with this one and this one, but nothing in the centre. So would you still not treat, or what would you do?
Well, I'll observe for signs of progression, because obviously the natural history on this guy is he's developed a massive membrane since his last image 20 years ago, where even then they said there was fluid on that diagram, I think,
Yeah.
and he's remained 6'6". So I would probably observe. He's
Okay.
not developed a massive hemorrhage, and the center is already a massive type 1 CNV that's non-exudative, and he's 6'6". So I would possibly observe,
Which
and
is
then if it
preserving
progresses
his retina.
anatomically, then I
Yeah.
would think, and there's no answer. I'm
that's
sure
the
people
discussion
have
point.
different views. Yeah. Great, fantastic case. Anything else? Otherwise, we'll move on to the next.
No, that's it. Thank you.
Fantastic case, thank you.